few weeks ago I got back from the most amazing trip in Morocco in the Rif Mountains with the Dental Mavericks charity. We're in the Rif Mountains providing dental treatment and getting children out of pain in really remote communities, and it was such an amazing experience. You might have seen some videos or photographs on our Facebook page. The country is amazing. Morocco is just beautiful. It is just amazing, breathtaking views in these mountainous landscapes. We were travelling out to these really remote, isolated communities in the mountains and providing the dental treatment, and the people are just so friendly and so welcoming. The children are so gorgeous, and again just so grateful that you're there to get them out of pain that they've been in for God knows how long. And these remote communities, they have very little dental education, very little hygiene. Some of them, this is the first toothbrush that they'd ever been given. And along with a really high sugar diet, they have a lot of tooth decay. And some of the children that I was seeing, every single tooth in their mouth had a little bit of tooth decay, and it was just a case of working out which one was the worst case to remove from them. The whole trip was a lot harder, both physically and emotionally, than I had thought it was going to be. Physically, we were getting up at sunrise. We were getting up first thing in the morning and travelling to a different school each day in a different remote community in the mountains, and setting up, and we were triaging the children and then just seeing child after child after child, just giving them treatment to get them out of pain. So it was tough days. It was 40-degree heat, so it was very sweaty work, and you were working a long time without a break or without any food. But to be honest, with all the adrenaline, you just wanted to keep on going and going and going and keep on treating more and more child till there was none left. So it was tough but enjoyable at the same time. And emotionally, it was obviously a lot harder than I thought. These poor kids are in a lot of pain, and they're living in really poor living conditions that is really underdeveloped in these remote communities, and they have such good spirits though. They're just so happy and so appreciative for what you're doing. And a lot of patients that I've seen already have asked about the language barrier, if that was a problem or not, but it really wasn't. We did have translators there if we needed them, if we got stuck, but you just create this connection with the child, and you reassured them and you relaxed them and you just tried to make them laugh. So it was a lot of fun and fun in the clinic. It was really, really a fun environment to work in. But I've come back, I think, a lot more positive, a lot more appreciative, and I definitely don't complain as much anymore. The Dental Mavericks, they organised the whole project, and it was a huge success. So in collaboration between our team and with the Moroccan dentists, we saw over 5,000 children. So 5,000 children got toothbrushes and toothpaste and briefed on how to brush their teeth, and over 2,000 children got treated and got out of pain, and it's just such a good experience. So thank you so much for all your donations, whether it was online via our website or at the desk in the practice. It has all gone to a really, really, really worthy cause.